just a little bit about me. My name is Christine Rutter, and I am an emergency and critical care specialist at the veterinary hospital. And so, what that means is that I went to veterinary school many years ago. I didn't quite work on dinosaurs, but I'm almost that old, so it's been a while. I was then a general practitioner for a couple of years before I went back and did an internship and a 3-year residency in New England, and then took specialty boards to become board certified in emergency and critical care. So not a lot of people know that there's specialists for veterinary medicine, just like there are for people, but we certainly do exist. And I kind of do a lot of things. I am in charge of the critical care unit, but I also see things on emergency. So I'm currently on duty today, so I'm hoping I don't get any phone calls while we're doing this. But anything that comes into the ER, we immediately triage it and have a look. And so my hope today is to talk to you about some of the common things that we see in the ER and kind of help, keep you from having to show up at the ER, because the ER is a pain in the neck. Like, nobody wants to have to be there. You see somebody you don't know, it's expensive, the wait is really long. We do know those things and we hate them. And it's just a crummy, not having an appointment is a crummy thing, and the pets are sick. So if I can help you stay out of the ER, that's my goal today. And like Val was saying, I'm pretty informal. And so if you have a question about something on the slide or something that you heard something else and you want to talk about, we should have enough time to talk about stuff today. So let me see if I can get my screen shared. All right. And boom. So does that look okay to everybody? Can I get somebody? All right, good. Thank you for the thumbs up. I appreciate that. All righty. So that's me. Let's see if I can get my slide to advance. Survey says no. There we go. All right, cool. So we'll do a little bit of kind of an agenda here today. We'll do some common toxins. We'll talk about bites and envenomation. We'll talk about heat illness, which, believe it or not, it's already hot enough for us to see heat illness. And just to take a step back, envenomation, we are seeing snake bites like crazy right now. So definitely be wary of that. We'll also talk a little bit about seizures, a little bit about choking, and then how to have a first aid kit at home. And then, like I said before, hopefully we'll have some time for questions and answers. Oh, my slide does not want to go today. All right, so first of all, you need to be aware as an owner that any injured, painful, mentally altered, or intoxicated animal can bite you, even your pet who you love more than anything, who loves you more than anything. If they've had a seizure, if they have had an intoxication, or if they're hurting, or if they're afraid something like traumatic has happened, that pet can bite you. And so you need to be very careful handling any pet that is having an emergent situation. If you are concerned that you might get bitten, you should not try to intervene, because animal bites are a really big deal. Dog bites are mostly crush injuries, but you need to go to the ER. Cat bites are especially prone to infection, and you need to go to the ER. So if there's one thing you remember, it's try really hard not to get bitten by an animal, because you need to go to the ER. And if you come to the ER with your pet, we're going to tell you to go to the ER. The other thing, and this is kind of silly, veterinarians love to say this, cats are not small dogs. And I think that's important to say to the public too. I think cat owners and dog owners, people who favor one or the other, are very different people. But at the same time, when it comes to medicine, realize your veterinarian thinks about cats and dogs very differently. They react differently to toxins. They have different pain behaviors. They like to be handled in different ways. They like different types of environments. And they have different reactions to medications, and they do better with certain medications than others. And so if you have cats and dogs, you're probably going to be aware of this. But if you're new to whatever species we're talking about, just realize that they're not the same, even though they're all mammals. Human medicine doesn't work for people, and cats and dogs are very different. So some common toxins to think about. Grapes and raisins are something that we try really hard to make sure people know about. Also, that includes tartaric acid. So snickerdoodle cookies will have tartaric acid in them. And so grapes, raisins, and snickerdoodle cookies. I'm not really a cook, so forgive me. I don't know what else you do with tartaric acid, but that is the main toxin in those. Those can cause pretty significant kidney damage. And so you want to make sure Dogs love to get into trail mix. They love to eat oatmeal raisin cookies or get into things, chocolate covered raisins, Easter, Christmas, holidays, those kinds of things. They love to get into grapes and raisins that we usually like to eat and cook with. So be very aware of that. And just a couple of raisins. So a Labrador can eat 3 raisins and have a significant intoxication from it. So it doesn't take much at all. They basically are unable to metabolize that tartaric acid. And so we have anytime your pet could have gotten into grapes and raisins, make sure you see your veterinarian. Most people know about chocolate. This is mostly a dog thing. Cats don't really have taste buds for sweetness. And so cats don't get into chocolate the way dogs do. And dogs know exactly where it is. So if you hide it, it's under the tree. If it's in an egg somewhere, your dog's going to find it. So chocolate has a stimulant in it. It actually has a chemical that's very similar to caffeine, and dogs can't break that chemical down. And so it would be like very similar to if you got like a stimulant overdose. And so dogs, if your dog gets into chocolate, be sure to take them to see your veterinarian. Macadamia nuts is another weird one, and this is very specific to dogs, and we don't know what causes it, but dogs that eat macadamia nuts can have a hyperthermia, like their temperature goes way up, and they can actually have heat stroke from eating macadamia nuts. So just be very careful if you have those in your household and you have dogs. And then another kind of weird one is raw bread dough. And like I said, I'm not really a cook, but for people that like to make, sourdough, or if you like to bake, be aware that the yeasts and the raw bread dough itself it can make ethanols. And so raw bread dough, not only whenever they eat it does it swell up and make them very, very uncomfortable, but they can get an intoxication from it. Having said that, homemade Play-Doh has a lot of salt in it. And I think we talk about this a little bit later, but if you make Play-Doh at home, that's another thing that dogs love to eat, and it's got a ton of salt. So these are all things you should plan to see your veterinarian if your pet gets into. I talked about those things with dogs. With cats, we're going to add to that list true lilies. We'll talk about that just a little bit more in the coming slides, but lilies, especially this time of year with Easter, we see a lot of lily exposures. And like I said, we'll talk about the difference between the lilies, but all parts of the lily plant are toxic. The leaves, the petals, even the pollen. Just pollen on a paw that they lick is enough for them to get pretty severe kidney injury. So lilies are a big deal. Tylenol is a big one with cats, acetaminophen. And I always think this one, it's not funny because it's very toxic, but if you try to give your cat a pill, you can't do it. It's really, really hard. But if you drop a Tylenol, the cat is going to find it and eat it. And I can't explain that to you. But if you have cats and you take Tylenol, you need to make sure you know where all of those pills are. Keep them in the bottle, keep it in a drawer, because Tylenol and cats do not mix. Cats are also more sensitive to insecticides. And this is really important, especially if you decide to buy over-the-counter flea and tick products. Even the products that are listed as safe for cats, you need to be very careful. All dog products are not safe for cats and can absolutely kill your cat. Some cat products some cats can be actually sensitive to those products. And so you need to stick to products that your veterinarian recommends because they're all a little bit different. Cats are very sensitive to pesticides and insecticides. So be very, very careful. And if you have someone who comes and sprays your home or your area, like around your home, make sure they know that you have cats because they will pick specific insecticides that are safer for cats. And then things that are common to both dogs and cats that we see commonly, xylitol is a big one. Xylitol is common in sugar-free products, and it's sometimes listed as birch sugar. And what it is it's the thing in sugar-free gums, like the ice, the little cube ice gums. And actually my favorite gum, which is the Orbit gum, has a ton of xylitol in it. And dogs love that sweet flavor. And so dogs love to eat sugar-free gum. And so if you're like me and you like a xylitol gum, like I actually just leave it at work and I don't take it home because I don't want all my little dogs to get into it. So be very careful if you are a diabetic or you have someone who likes to make sugar-free products. It's very common. Diabetics will use it. People who do like keto diets or other carb-free diets. Or if you're just trying to watch your sugar intake, just be careful with those products because dogs will get into them. And then weirdly, some cats do too. Some cats really like a wintergreen. And so if you have wintergreen gum, they'll get into that. And just one piece of gum is enough to be very serious. Can cause low blood sugar, it can cause liver disease, and it can cause seizures. And so if your pet gets into xylitol, pretty much the answer to all of these is going to be to see your vet, but that's a big one to know about. Non-steroidal medications, this includes both medications for pets and pet and human medication. So NSAIDs is an abbreviation for non-steroidal anti-inflammatory drugs. And a common one would be aspirin or ibuprofen or Aleve. These products are great for people and terrible for cats and dogs. You don't ever want to let a cat or a dog get into any of those products. There are non-steroidal medications that we use in dogs and cats. Some common ones would be things like carprofen or meloxicam or Metacam. Daramax is another one, and those are safe for dogs and cats to a certain dose because just like anything, if you take 2 ibuprofen, you're probably fine. If you take 20, that's not great. And since a lot of the veterinary products are flavored, if the animals have the opportunity to get into a bottle of them, they're going to go for it because they taste delicious. And so be aware that these medications in excess can be very dangerous, can cause GI disease, kidney disease, and liver disease. And in huge excess, they can actually cause seizures as well. Another one to talk about is mushrooms and mold. And if you're saying to yourself, well, I wouldn't ever let my dog get into those things, understand that this also includes things like compost or not to be too gross, but like a dead bird. It's got mold and stuff on it. And some of the molds, old food that's been stored improperly, like if you put dog food in a big container that's not sealed that you keep in your garage and it's hot and it's humid, it can grow mold. And so you want to make sure that your animals don't have access to mushrooms and mold. Mushrooms and mold are really hard to tell the difference between the toxic ones and the non-toxic ones. So if you see mushrooms in your yard, try to kick them over and get rid of them. And anything that looks a little bit moldy or that you're concerned about, just get rid of it because these can be very bad toxins. And it's almost impossible whenever you take pieces of the mushroom to your vet, it's almost impossible for them to tell you, is this a bad one or not? And they basically do supportive care and hope for the best. There's not a lot of antidotes for those poisons. Onions and garlic toxicity, we see that commonly. And if you're thinking to yourself, what animal would get into onions and garlic? Honestly, tons. We see this most frequently with like fajita seasonings or taco seasonings. Animals love, both dogs and cats love to get into that. But we had a dog a couple of days ago that ate like a whole bunch of like sour cream and onion chips. And that was actually enough to cause toxicity. So any kind of onions or garlic in the environment, you want to be very careful with those. Ethylene glycol is just the fancy word for antifreeze. And antifreeze is, sure, it's in your car, but it also shows up in other weird places. It's actually in snow globes. And so if you're a snow globe fan, just be careful because if they leak, which actually that happened to me this last Christmas, I saw like a puddling on the floor and I was like, that's kind of weird. It was sort of under my sofa. And I had a snow globe out that leaked. And the clear stuff that's in there is ethylene glycol. And so snow globes, the liquid stuff that's in the base of basketball hoops, that's also ethylene glycol. And then, of course, traditional antifreeze. So just be very careful if you have those products around. Make sure your pets, dogs and cats, can't get into it because they both really like to get into it. And it doesn't take very much at all to be a problem. We've kind of talked about non-steroidal medications as far as human medications, but understand that, most human drugs are dosed for a mammal that is 75 kilos or more. And so really common for just one pill of something that a human takes to be toxic to a dog or a cat. The most common things we see are things like muscle relaxants, cold medications, anti-seizure medications, antidepressants. I don't know why pets like to eat them, but they find them along the floor and they ingest them. And all of those things can be incredibly toxic. I'm going to give you some resources in a few minutes to kind of talk about like how do you make a decision to go to your vet or not. But I would encourage you, if you suspect your pet has gotten into any medications or any toxins that we've listed here, scoop them up, get in the car, have your friend or partner start calling poison control, and they'll give you that number in a second, because all of these can be quite bad. And the last one is rodenticides, which is that's pretty straightforward. Everybody kind of figures rodenticides are bad for dogs and cats, and that's true. I have a little picture here. This is actually a friend of mine's dog. We had a decon box, and so we actually had to put a little peanut butter on that box to get her to be interested in it. There is no decon in it. But rodenticides do the same things to dogs and cats that they do to mice and rodents. And so there's a couple of different kinds out there. So it's important, if you find that your pet has gotten into a rodenticide, if you at all know the brand or the type that it is, that's really important. Even if you just bring the box, that's very helpful. Most rodenticides are going to have either a blue or violet dye to them. And so if your pet has like a teal poop or a lavender poop, they have gotten into rodenticide, and that dye is put in there so you can tell if rodents are ingesting the product. But if your pet has teal poop or lavender poop, and I mean, it looks just like Play-Doh, like it is absolutely that color, that is something you need to see your vet immediately for, because some of these can have delayed effects. Some of them you don't actually see the effects for, 4 to 5 days. And so the sooner you get treated for those things, the better.
Hey, Dr. Rutter, we have a
Yes,
question. Is
great.
Benadryl safe for dogs?
Benadryl is safe for dogs, yes. You need to talk to your veterinarian about dosing, because unlike in people where we just say, oh, take 2 aspirin and call me tomorrow, everything is based on weight in pets, just like it is in little children. And so, yes, Benadryl is a good medication to use in dogs, and talk to your veterinarian about when you would want to use that and how much you would want to give your pet. All right, let's see here. Let me close that down. Great. All right, so we mentioned lilies just a little bit. Lilies cause kidney damage. And as I was saying before, every part of this plant is toxic. And one of the things that I see a lot of times is a cat will just nibble on the leaves. And the people will say to me, oh, it's not a big deal. And it really is. And even the pollen, you can see the pollen here in this lily here. They get it on their face because they're like sniffing it. Little cats love to sniff lilies. And then they clean their face, and then they lick their paws. Like, unbelievably, that is absolutely enough to cause intoxication. So I recommend that you don't have these in your household at all if you have a cat. And if someone sends you flowers or you order flowers for your household, make sure that you request that they do not have lilies in them. And I find lilies to be really hard. I mentioned that I don't cook. I'm also not good at flowers. And so I use online plant identifiers, and I'm going to give you a resource in just a moment to help you with that. There are also some Facebook groups for different plant and toxin identifiers, and those can be really helpful because anybody can join those. And so if your pet got into a plant, you can post a picture of it and they will help you. They can't give you veterinary advice, but they can help you identify the plant. And so I'm going to lie to you if I say that I know what all of these lilies are, but I can tell you that I looked them all up. You guys probably know this better than I do. I know the Easter lily, the white one, I got that one, but all the rest of these, to my eye, look very similar. But I can tell you it's the true lilies, and their scientific name is going to start with lilium. And so for me, I have trouble telling them apart. I always use an online plant identifier. Either there's a website I'm going to give you in just a moment, or use one of those Facebook groups to be 100% sure. Because if it's not a big deal, great, your cat can go home and it's fine. And if it is a true lily, it's a big deal. So that's going to include stargazers, Easter lilies, daylilies, Asian lilies, and tiger lilies. Those are all very, very bad. And then I call these fake lilies. They are things we call lilies, but they aren't actually. So this is more common around Christmas time, but the amaryllis, which is the little red one down here at the bottom, that's called a St. Joseph's lily. It's not actually a lily. The calla lily, which is the top right, the pink one, that one's very commonly seen in the spring and summer. And then the peace lily, which we also see around Easter time. Those are not actually lilies. These plants do have irritants in the leaves. And so if your pet chews on these, they may have drooling, they may be uncomfortable around their mouth, they may even vomit, but they're not in like life and death danger. They may need some things from your veterinarian to help them be more comfortable, but they will be okay. this is very different than the actual Lily situation. So if you have these in your home, just keep them away from your cats and your dogs, because dogs can have the same irritation. But this isn't the life or death situation that we see with the true Lily species. And these are the resources that I was promising. So there are a couple of pet poison hotlines out there. They all offer some information. Most of them also do charge. So there is a fee associated with using these. I forget what the ASPCA is charging now. I want to say it's $85 or $90. And if you're thinking to yourself, oh, that's a ton of money, it is a ton of money. And it's a lot less than going to the emergency vet. And so it also provides the most up-to-date research for, does your pet need to go in, or is this actually okay? That also includes if your veterinarian would need information about this toxin, and what if your pet needs, or what if your veterinarian needs information on treating your pet. They do an unlimited number of consults for each intoxication. So if you're really concerned about an intoxication, I think the best thing you can do is call the Animal Poison Control Hotline. The ASPCA is my favorite one, and that is because they use veterinary toxicologists, and these are people that have a veterinary degree, and then they also have a toxicology degree, which is really hard to get. And so these are big time experts. These folks know what they're doing. And for me as a veterinarian, they're an invaluable resource. We call them all the time. So I highly recommend the ASPCA Animal Poison Control. And then their website is also really helpful. They do have good information on common pet toxic intoxications and what thing is an emergency and what things aren't. But they also have a plant database. And I use that plant database a lot because, like I said, I stink at identifying plants. And so for me, I use those pictures and like an idea of what kind of intoxication we're talking about when I need to call them and talk to them about what's going on. So I think these are really good resources and I highly recommend them.
I'm not sure if you're going to go over it, but what are some common signs that show a pet has ingested a toxic substance?
Oh, that's a great question. Thank you for that. So sometimes it depends on the intoxication, right? So some things are stimulants and your pet will be jittery or anxious or upset. Sometimes they're drooling, sometimes they vomit. Some things, like if your pet gets into your muscle relaxer, or like, I know none of you would have marijuana, but if you had marijuana or any other illicit substances, sometimes they're sleepy, sometimes they're dribbling urine, sometimes they walk like they're drunk, or maybe they don't know where they are. Sometimes they can have seizures. It's a whole myriad of things. Even a cigarette butt. If you're walking down the street and your pet picks up a cigarette butt, there's actually enough nicotine in that cigarette butt. It's probably not going to kill your pet, but it definitely can make them seem really mentally off. And so if your pet seems off in any way, it's probably better to get help sooner rather than later. But it really can be anything. I'm sorry I'm not able to give more specific information, but it really just depends on what they get into. Does that answer that question more or less? All righty,
Yes. Thank you.
great. So I mentioned a little bit about animal bites, and I was talking mostly about people, but I will add to that. Animals, of course, bite each other. And one of the most common places we see animal bites is at the dog park. And so, do I recommend dog parks? I don't really know. I think there are pluses and minuses about dog parks. And I'm sure you guys are all fantastic humans. I'm sure your pets are all fantastic pets. And not everyone who goes to the dog park is a fantastic human and has a fantastic pet. Not everybody is vaccinated, and not everybody is up to date on preventatives. And so it's a high population area. So, it's just like going to a concert. You could get injured, you could get a respiratory infection, like who knows? I guess I will say that animal bites, they happen fast. And the big thing is make sure you don't get bitten, because if you get bitten, you need to go to an ER. But when you're dealing with animal bites, keep in mind they happen fast and most of the damage is under the surface. And so if you're looking at, let's say, unfortunately, your pet gets bitten, and you're thinking, oh, it just looks like a little puncture wound. It doesn't matter. You need to see your veterinarian, because just like the picture of the iceberg up there, most of the damage, especially in a dog bite, is crush injury. They actually, their teeth are made for crushing and tearing. And so you wouldn't expect huge lacerations. A lot of the tissue that is under a bite will be severely damaged. These bites are highly at risk for getting infections. And so you need to see a veterinarian. Need to have the wound clipped and cleaned and explored to make sure it's not a big deal. That's just, I can't tell from the surface if it's a big deal or not. I can't tell you how many times I've been surprised and it's worse than I thought, or I thought, oh, this is going to be a bad one, and it's actually not so bad. So I guess it's just to say you really do need to have a professional look at an animal bite, and you really do need to have that done on an emergency basis. I don't think that is something I would wait until the next day to get looked at. So animal bites are a big deal. And the other thing to be aware of is the state of Texas requires that your pet be vaccinated for rabies. And every county in Texas has different laws with regards to what vaccines it recognizes and how it handles animal bites. That's animal bites of humans, animal bites of other animals, and wildlife bites of animals. And so it is, your veterinarian is going to be your best resource as to what the next steps are. Like, should your pet get a rabies booster? Does your pet need to be quarantined? Can that quarantine happen at home, or does that happen to have to happen at your vet's office? There's a lot of convoluted legal stuff there. And I guess what I would recommend is make sure your pet's rabies vaccines are up to date. That is the biggest advice that I could give. Most counties are going to recommend or recognize a 3-year rabies vaccine after their first dose of rabies vaccine. It's not that hard to do, and the things that can happen if your pet bites somebody or is not bitten, or excuse me, or is bitten and is not rabies vaccinated, rabies is lethal, and it's lethal 100% of the time. And so honestly, it's really easy to make sure that they're rabies vaccinated, and the consequences are high. So unless your pet has an autoimmune disease or a reason they can't receive vaccines, make sure that you get rabies, that your pet is rabies vaccinated. It's a big deal. All right, moving on to envenomation. And like I said, I'm sorry if you don't like snakes. I should have given you a heads up that there was going to be snakes on this. I do have people that don't like this slide, and I certainly understand that. But I do think it's important to talk about snakes because we have been seeing snake bites since the last week in February. Bluebonnet season is always snake season. And while I love bluebonnets, the snakes are less cool. So on the left side, both pictures on the left side are of copperhead snakes. They are by and large the most common snakes that we see here in College Station in this area. On the bottom is an adult snake, and on the top is a juvenile. And I mention this because the juveniles have a very distinct yellow or white tipped tail. I'm also not amazing at snake identification, so I rely on photos. If clients can bring me a photo of the snake, please don't chop its head off and bring me the body. That's actually not a good idea at all. Snake heads, even if you chop them off, they can bite you. They have a reflex where a snake head can actually bite you for up to a couple of hours after being decapitated. So please don't try to handle the snake. If you can get a photo of it, that's great. But usually I can tell what it is from when you bring your pet in. Dogs typically get bitten on the face or on the shoulders and front limbs, and cats typically get bitten on their front paws. Well, certainly they can get bitten anywhere, but those are what is most typical. You can usually tell that your pet has been bitten because you'll see one or two little punctures with just a tiny trickle of blood, and that area is going to be amazingly painful for your pet. Some people see the snake, some people never do. They're everywhere here in Texas. And like I said, copperheads are going to be the most common. I don't see that many rattlesnakes in this part of Texas, but certainly in more eastern Texas and more western Texas, I do see more rattlesnakes. And then I do see coral snakes very uncommonly. There are 2 species of coral snake in the United States, and thankfully here in Texas, we have the less awful one. These are actually non-aggressive snakes. These are very nice snakes, and they have very tiny fangs. And so what usually happens is a pet starts to play with it or starts to kind of attack it, and it bites by defending itself. They have tiny little fangs. They have to really chew on a pet to envenomate your pet. those pets are usually not painful, but they can cause neurologic dysfunction. And if it's a severe bite, those pets may need to be on the ventilator for a couple of days. So it can be a big deal. There is antivenom available for both the copperheads and the rattlesnakes. We have that here at Texas A&M. There is only one place in the country that has antivenom for coral snakes, and that is the University of Florida. Having said that, there's not a lot of great data that coral snake antivenom is super useful. So while I'm sad we don't have it, I don't know that that's what's going to make or break what happens to a pet that gets bitten by a coral snake. But if you see snakes in your area, which if you live in Texas, you have snakes in your area, how do you keep them off your property? Well, you really can't. They're really all of the like snake, what do you call it when you try to get rid of something? The things that repellents, all the snake repellents, they don't really work. And so the best advice I know to give you is before you let your, like, don't let your pets run loose on a property, because that is a risk factor. And even here in town, like I've seen snakes in my yard, and I live in kind of one of those cookie cutter neighborhoods in College Station, and I've seen them in my yard. So for me, I turn the lights on, I make a good bit of noise, I make sure I check the yard before I let my dogs out. It's a pain in the neck to do that every time, but snakes are everywhere in the environment, but they aren't looking for a fight. They aren't trying to attack your pets. So if you give them a chance to run away, they definitely will. All right. So moving on to heat illness. It is warm enough, anytime it gets into like 78, 80 degrees, it is actually warm enough for pets to get heat illness. And we typically talk about this as heat stroke. There's actually a couple different definitions for stages of heat stroke, which is kind of beyond the scope of what we're going to talk about today. But I don't know if you guys remember this from like 7th grade science, but the ways we get rid or accept heat, radiation is like how the sun, like when the sun feels warm on your face, that's radiant heat. It's also how you get rid of heat. You just radiate heat into the environment. Evaporation, which for dogs and cats is through their mouth, through panting, or through their foot pads, through sweating. For us, we sweat everywhere, so evaporation is a big part of how we get rid of heat. Conduction, which is directly touching something, and then convection, which is just like a convection oven. It means there's a hot breeze or a cool breeze that changes our body temperature. And the reason why this picture is so important is because as humans, we sweat everywhere. On a hot day, we wear products to keep us from sweating so that we don't embarrass ourselves. Dogs and cats really only sweat on their foot pads, and they evaporate whenever they pant. And so they are very dependent on radiation, convection, and conduction to get rid of heat. When it's really hot, they don't have that much evaporation. And so their ability to get rid of heat is much less than ours. Also, their metabolic rates are much higher than ours. And so they produce a lot more heat. And so this is a much bigger deal for them. It's also important to remember that evaporation doesn't work at all when the humidity is over about 80%, which is a lot here in the Texas summer. And so really, they're very limited on the ways that they can get rid of heat. And so pets are at more risk of heat stroke than we are, just because their ability to get rid of heat is less. And so the thing I tell clients is if you're hot, they're hot. You cannot leave pets outside. They do acclimate to a point, but it's really hard for them whenever it gets hot. We always talk about cars and how hot they get very quickly. There's a very cool YouTube video of a kind of famous veterinarian who sits in a car with a thermometer, and it takes about 15 minutes to get crazy hot in a car. We all know this because you get in the car after going to the HEB for just a few minutes and it's hot and humid, but that is an oven to your pet. You shouldn't ever leave your pet in a car. I know there are some cars now that have like pet settings, and as long as those don't fail, it's probably okay. But to me, it makes me very nervous to have a pet in an environment where they could get too hot. Honestly, even when it's 70 degrees outside, it is too hot to leave your pet in a car. So the best things you can do when the temperature gets up Make sure there's a breeze. A fan really helps maximize that convection cooling. Also, play in the water. I have a little kid with a hose there, spraying a Labrador that's obviously loving it. That's very true. Like, pets don't sweat everywhere, and you can improve their evaporative heat loss just by wetting them. You don't really want to use ice water because you don't want their blood vessels in their skin to contract. You want to have good blood flow to their skin. And so just nice, cool water, play in the lake, play in the hose, make sure they have lots of water to drink. Those are all good ways to keep them cool. And if you're getting too warm outside, time to go inside. And the other part of this, of course, is shade. The same things whenever you go to the beach and it's 100 degrees, you want a cool drink, you want to get in the water, you want to stay in the shade, and you want a fan. And your pet is going to be very much the same. And if you're too hot, they're too hot. All right, and I'll move on to seizures. Seizures are hard because there's a lot of different things that cause them. Just like humans, sorry, I'm getting messages from the ER. I just need to make sure everything is okay. All right, everything is okay. Sorry about that. I'm on duty today as well, so thank you for being patient with me. So just like some people have epilepsy, some pets also have epilepsy. Dogs and cats. And some pets with epilepsy take anti-seizure medications, and they do it all the time. I myself have had an epileptic dog. You can't truly know that it's epilepsy and not something else without doing some advanced imaging, which is pretty expensive. But there's lots of pets out there that have had seizures off and on for years and do okay with them, and that's okay. What's concerning is that if you have an older pet that's having its first seizure, or if your pet has many seizures in a row, or if they don't return to completely normal after their seizure. So seizures can last anywhere from 3 to 5 minutes. They can be anything from like an eye twitch or compulsively looking at something, to a flicking tail, to the kind of full body seizures that we think about that we've seen in the movies. Those are things are all very possible. If you have a known toxin or medication exposure, it's important to know that whenever you see your veterinarian. If your veterinarian is concerned that this could be a brain disease due to doing a neurologic exam and finding some changes there, or if you have an older pet that's having their first seizure, they may recommend that you see a neurologist, and the neurologist is going to be who can help you decide, is this an epileptic pet or is there something actually going on in the brain? Those do tend to be pretty serious conditions, and working them up can be very expensive. And so it's not for everybody. But some common things that cause seizures in the environment. I talked about homemade Play-Doh a few slides ago. That's got a lot of salt in it. Also, drinking a ton of salt water. If you take your pet to the beach and they drink salt water, that can cause them to have altered mentation or seizures. Also, ingesting compost. We talked about mushrooms and mold. You can definitely see seizures after eating compost. Those are really nasty intoxications. So if you have a compost pile, make sure your pets don't have access to it. But those are pretty bad intoxications. I have antidepressants on here. Most human antidepressants are going to fit in that category, and most animals are going to have pretty significant side effects from even one pill. Having said that, lots of pets take antidepressants actually, and so there are a couple of them that we use. What's really important though is the dosing. And so if your pet gets into your medications, that's very different than a medication that has been prescribed for your pet. So make sure you are up to date on that. And then the last one is kind of the plant that's on here, and that's a sago palm. Sago palms are everywhere. You can buy them at the grocery store. You can buy them at home improvement places. They're used very commonly in landscaping because they're very hardy and drought resistant. Every part of that plant is toxic, and they like to make little seeds that are about this big. I don't know, what is that, an inch and a half, thereabouts. And dogs love to eat those. And those are terrible intoxications. I think it's really hard because I see a lot of pets die from getting into sago palms. And so if you ask me, I would get rid of all of them in my environment if I had a pet. And I bet your landscaper would wish you wouldn't do that. So I'll let you make your own decision. But even like dried and dead, this plant is very toxic. So make sure you're very careful with the plants in the environment. during the event itself, a seizure looks very scary. And like I said, I very much know this. I had a pet that was epileptic, and those seizures felt like they took 20 minutes, but in reality, most of them are less than 5 minutes. The seizure itself doesn't hurt, and your pet won't have a memory of it. It is very similar to people with epilepsy. People with epilepsy typically wake up and they're on the ground and everyone is staring at them, and they're like, what's going on? I myself am not epileptic, so I'm not speaking from experience. So if I'm misspeaking and you know more, please correct me. But the best things you can do for your pet is make sure that they can't fall. So if they're on a sofa or if they're near stairs, if you can, get them onto a rug and move them away from a place where they could hurt themselves or fall, that would be good. They are not going to swallow their tongue. They're not going to aspirate. So you don't need to worry about reaching in their mouths. I would recommend that you don't reach in their mouth because most pets, you have an instinct. It's true in people as well. If you have altered consciousness and you feel something in your mouth, you bite down. And so it is very common for pets during or immediately after a seizure to bite their owners. It's not intentional. They're not trying to be mean. They're just confused or they're fearful. Many pets are mentally abnormal for an hour or two after a seizure. And so they can be very fearful. My own dog didn't know who I was for about 30 minutes after each time she would have a seizure. And so I would just sit nearby her, talk to her very calmly, until it was very funny. She would look at me and then all of a sudden she'd be like, oh, yeah, I remember you. You're the person who feeds me. Cool. Like it would just be like a light that turned on where she was better. And so that can definitely, that's very, very common. People report that. Just be aware to keep yourself safe and keep your pet safe. If this is your pet's first seizure, you should let your veterinarian know about that. And you should plan to go to the veterinarian if the seizure lasts more than 5 minutes, if they have multiple seizures in a 24-hour period, or you suspect an intoxication, or your pet is more than like 8 or 9 years old, you should just plan to see a veterinarian, even on an emergency basis. Always a good idea. Better to get vet advice than not. So those are my basic recommendations on seizures. And like I said, some pets have one seizure every 6 months for their whole lives, and it's not a big deal. And other ones are very naughty seizures, and they have bad seizures very commonly. So working with your veterinarian to find the best plan for your pet is really the way to go. Choking is another thing I get a lot of questions on. I put this picture up there because it is widely available on the internet. And I will fully admit that I don't know how much of a fan I am of this. So the Heimlich, choking is commonly reported, and it actually doesn't happen all that much. It is relatively common for your pet to get a piece of kibble stuck in its throat the same way you might. But in the same way, hopefully you've not needed the Heimlich maneuver, although some people do, but it is uncommon. Your pet is probably the same. Like if you can hear them moving air, they just need some time to clear it. If you truly feel like your pet has an airway obstruction, those pets are usually going to have delirium where they're confused, they're going to be weak. And whenever you're going to see them look at you and you're not going to hear any air moving, you're not going to hear any choking or coughing. It's just going to be, kind of what we talk about with choking about. Your pet will do something very similar. And so I don't know how I feel about a lot of these, like the wheelbarrow thing on the left. I don't know that that's really going to do anything. I worry about a pet that is in a traumatic situation or in a fearful situation. I worry about putting your hand in there in an awake pet. I worry you might get bitten doing that. I do think option C here, compressing the abdomen in a Heimlich type situation, that could be helpful. And then the sharp blow between the shoulder blades might also be helpful and also safe for an owner to do. So I guess I'm going to recommend C and D more than anything else, but honestly, get to a vet as soon as possible. Those are going to be the big things to do. I'm not going to recommend A and B, but like I said, I put this up there because it's on the internet, and I'd rather have you know what I think about it than not show it to you. And then this is a cool video. This was on the news. Gosh, it's been a couple years now. And I think this is especially applicable for people who like to play ball with their dogs. I've got one dog that is a maniacal ball chaser. And tennis balls and racket balls and things are remarkably hard to get out of the back of a throat. And I think this is something that owners could potentially do. So this is like a kind of a puff news piece. And I'm not going to show the whole video, but I do think this is a valuable thing to have seen because it's kind of cool. And I haven't gotten to do this yet, but it's on my list of things to do.
Amazingly, 20 minutes before Hansel came in, a choking Doberman had the same technique applied.
The term that was coined for this is the external extraction technique, and it's essentially a similar type of a Heimlich kind of a thing.
Dr. Williams says she remembers seeing a demo of the technique in this training video.
I'm pushing down and up. It's like a J stroke. And we can see the ball pops right out.
So they're flat on their back here.
She says every dog owner should know how to do this.
The ball is going to be in this area here. With the ball being here, my thumbs are going to be on the back edge of the ball here, and I'm going to push the ball down and up through the mouth.
Should we stop using these tennis balls when we're playing catch with the dog?
All right. I'm not going to have us listen to the rest of that, but I think it's pretty cool. And if you're someone who likes to play ball with your dog and you've never felt the larynx, which is kind of the hard part in the throat, you can feel it vibrate when you talk. Like, feel what your dog's larynx feels like if you've never done that before, because if your dog were to ever choke and get a ball back there, you're going to feel this big hard thing that doesn't feel the same as the larynx. And so I think this is a useful thing to do, honestly. As a veterinarian, this is a really good skill. We pull out a lot of foreign bodies from throats. I think this is good. This could save a life. So yeah, feel your dog's larynx. If you feel brave enough, I think in the moment anybody would try this, roll them over, try to pop that ball forward. I think this is a good skill.
It is remarkable video. A veteran.
Okay, we're not going to do that again. Sorry. Alrighty, but some things that aren't choking. So we see a lot of pets for choking, and they're actually doing normal dog things. So this is a dog that is reverse sneezing, and reverse sneezing is exactly what it sounds like. It is a reflex, the same way you sneeze. It just goes the other way. And if you're not used to it, it sounds pretty bad.
Keep going, Duchess. Don't stop.
I think Duchess is just looking for cookies. I can't blame her. So that's really common. All dogs do that, and some cats do that. That's usually due to an irritation in the nose, and some animals do it more than others. But you can tell this is not choking because the dog's kind of got its mouth open. It's still wagging its tail. It's pretty happy. It's got an irritation in its nose. And you can tell that air is moving because you're hearing sound. And so this is a pet. If this is a new thing and it really won't go away, take them to your vet, have a look. Sometimes they can have little grass pieces in their nose or a piece of kibble like up in the back of their nose. Those things can definitely happen. But your pet is not dying if it reverse sneezes. These are usually pretty happy emergencies because we get to tell them, oh, good news, your pet has a nose irritation. It's going to be okay. This is another thing we see commonly. This is especially common in small breed dogs. So Shih Tzus, little poodles, Pomeranians, Pekingese, those kinds of things. The little tiny dogs, Chihuahuas will do this as well. This is called tracheal collapse. It is very, very, very common in little dogs. It is usually not life-threatening, although if your pet is turning blue because of it and does this a lot, there may be things that you need to talk to your veterinarian about doing. But this is a very classic sound that we hear in pets that have tracheal collapse. And this is just where the rings of their trachea are weak. It's not anything you did to your pet. It is just it's a breed specific thing. So forgive my videoing skills. That is not what my degree is in, but that's very classic. That kind of honking sound that you hear, that's tracheal collapse. This is a pet that is not going to be heat or humidity tolerant. This is a pet that's not going to be very athletic. Their respiratory system is compromised. But see how this pet is nice and stable. This pet's got bright eyes. It's curious about its environment. This is not a pet that's in distress. Another thing to think about, and I know I've talked a lot about dogs and less about cats, but one thing I do want to mention, cats and hairballs. I'm sorry, the picture of the hairball is a little bit gross, but what I want to say is if you think your cat has hairballs and you always hear them coughing up hairballs, but you don't ever find the hairball, it is probably more likely that your cat has asthma. Cats get asthma the same way that people do. And while it is not usually an emergency, usually you hear them coughing and you can talk to your veterinarian the next day, they can have asthmatic attacks just like people can. And people think it's a hairball because in every movie ever where the cat has hairballs, it makes this noise. And you can see the cat's even swallowing a little bit. It's because they do cough up a little bit of phlegm, but this isn't vomiting a hairball. This is a cat actually having an asthma attack. Cats don't usually cough because of heart disease or other reasons. So if your cat coughs, especially if it's seasonal, it is probably asthma. And this is probably actually not a hairball. If you are interested in learning more about how you can do pet rescuing, there are a couple of resources available to you. I am a member of the College of Veterinary Emergency and Critical Care, and our college does have a pet rescuer certification that you can take online through Recover. Recover, it is a really great acronym, and I wish I could tell you I could remember what it stands for, but this is our CPR initiative. There is CPR for dogs and cats, and there is a pet owner module that's available. I think it's around $35, and you can find that at learning.ecvec.org. It's a good course. I'm an instructor for the in-person version of this course. We don't offer it that much here at the veterinary school, unfortunately, because we are focused on teaching veterinary students and our interns and residents, and so we don't have a ton of time to do this. But the online modules are great, and if you are interested in it, it's not a ton of time and it's really good information. So I recommend that you check that out. A lot of people ask me about first aid kits. I'm going to recommend that you have a muzzle to keep yourself and your pet safe. Although if your pet is vomiting, you should not put a restrictive muzzle, like a basket muzzle is safer if your pet is vomiting. If you're saying to yourself, my pet would never bite you, I wish that were true, but every pet can bite. Honestly, every person can bite, right? Like if you hurt enough, you bite. So anyway, a muzzle for everyone's safety, an e-collar or a donut. You can buy those from your veterinarian. You can buy them from PetSmart. I have a bunch of them because I have a couple of dogs and, you know, they cut their foot or whatever, and I need to put something on them so they don't lick it while I'm trying to get them into work or get them to my vet. I always recommend having a good e-collar or like an inflatable donut around. Those are very helpful. A gauze roll is helpful. A towel, good for cleanups, good for moving pets, good for picking up pets that might bite. You can use a towel to help keep them from biting you. Always a good idea. A small flashlight. I actually carry one in my pocket. Always good for looking in throats, looking in eyes, looking at wounds. You never know when you need a little light. Tweezers are very helpful. The most obvious reason is to remove splinters and ticks. And I have a diagram up there on how to remove ticks. You want to grab them right by the skin and pull. The longer they're attached, the more they kind of stick in. But full removal of ticks is important. Safety scissors. Cutting your pet with a regular pair of scissors is really common. Get some bandage scissors. They're really cheap. You can buy them just about anywhere. So either safety scissors with rounded edges or like bandage scissors, always a good choice so that you don't accidentally cut skin. Non-adherent pads, the same thing you would use on your own wound. Medical tape, again, the same thing from a human first aid kit. And then self-adherent nonstick tape. We call that vet wrap. I'm afraid I don't remember what it's called in human medicine, but it's that like 2-inch or 4-inch wrap that kind of sticks to itself and kind of has it has a lot of friction to it, but it's elastic. You can buy that at Walmart. So that's a very good thing to, like, you know, if your pet gets a wound, put a pad over that and put some of that non-adherent tape over it while you're waiting to get to the vet's office. All these things are really good to have. And then I can see we have a couple of comments in the chat. So I guess we ought to get ready and do some of those. This is my crew. I used to have a normal number of dogs, but then I inherited a few. So now I have a lot of little dogs, and these are all my little dogs. So, all right, let's see.
They
what
are
we've
so
got.
cute. Luckily, a
Thank
bunch
you.
of the chat is just everyone talking about just how cute and funny their dogs are and how
Oh,
what
good.
worked. And you actually solved a 10-year mystery with the reverse sneezing. So that was funny.
Oh, okay.
We did get a question about what is I'm trying to find it. There it is. Do the snake vaccines do anything? Not like the
Oh,
anti-venom, but the vaccines that
that's
are
a
sometimes advertised.
that is a great question. So the snake vaccines are very controversial in the veterinary community. And I will tell you what my opinion is. So a vaccine works by showing your body something bad so that your body can make an antibody to it. So whenever it gets shown that whatever it is again, it can kill it. The problem is when you think about venom, venom isn't like a bacteria or a virus. Like you're actually getting a couple of milliliters of poison injected into you. It's not possible for your body to make enough antibody that quickly. Think about whenever you get sick. It takes you 2 or 3 days to start to get better. And even if you've been shown that venom before through a vaccine, it takes 2 or 3 days for you to start making enough antibody to be useful. And so it doesn't make sense to me how a vaccine would really change that much. It doesn't decrease the need for antivenom, and it doesn't decrease the need for a pet to see a veterinarian to get checked out, because venoms can do everything from kill tissue. You can see tissue sloughing. You can see changes in coagulation. You can see red blood cell lysis. So dogs need not just plasma for coagulation, but also red blood cell transfusions. They can also cause neurologic things. So my answer to you is no, I don't think the rattlesnake vaccines are helpful. I don't think it's possible for the body to make your body or your dog's body to make enough antibody to neutralize the amount of venom that gets injected into the body. And no study that I have seen have shown improved survival from snake bites or a decrease in need of antivenom. And antivenom is a big deal. It's like $800 for a dose of that, and it depends on the size of your dog. So it could be more than that, it could be a little less than that, but it's expensive. If I thought it would decrease your pet's need for antivenom or improve survival, I would recommend it, but I don't have any evidence that it does that. So my little dogs don't have rattlesnake vaccines. I would love for the literature to prove me wrong, but right now I can't really support it.
Awesome. That was really insightful because I was curious about that as well.
It's a good question.
Yeah, we're just about at time. So does anyone
Oh,
else
okay.
have any more questions? You can go ahead and unmute yourself or put it in the chat real fast. I'll give it about another minute or so. And if not, I'll just go ahead and say my thank yous right now because that was so incredible. And I realized my my camera was off because I was just coughing up a lung. But thank you so much for everything. This was incredibly informative. And I know some people had to leave for another meeting, so they're itching to see the rest of this presentation. So thank you so much for this. I'm probably going to ask to see you again in the future again, because this was just
Anytime.
fantastic.
Of
Awesome.
course, anytime. I'm always happy to chat with you guys. I can't give you a ton of information about your pet specifically because I won't have met your pet. But if you have other questions, my email is down there. Like every professor, I'm at email. I answer most of them. If I haven't responded to you in a day or two, please just email me again. Because I'm just like every professor, a little bit off when it comes to email, but my email is down there. Please feel free to reach out. We're always happy to see you here at the vet school. Although I hope you never have to see me because like only the sickest of the sick see me. So this is the best way to see me. Let's keep doing it like this.
This is preferred for sure, but there's a lot of great conversation in the chat today. So thank you everyone who participated and thanks for coming out. And I will go ahead and try to get this uploaded as fast as we can to our YouTube. So just a friendly reminder, check out our YouTube if you haven't already. If you missed some classes, movement classes, or special speakers that we have, we usually try to record those on there. So thank you so much, Dr.